Assalamu alaikum. In this video, we would talk about the treatment of the bacterial corneal ulcer. As in the previous video, we have discussed about the pathogenesis and all the complete stages, and what are the signs and symptoms, and what are the investigations for the bacterial corneal ulcer. Now, let us start the treatment. First of all, you must know that as bacterial corneal ulcer is caused by a bacteria, so you first have to control that infection that is caused by bacteria. For controlling the infection, you should use some topical antibiotics or antibiotics, as it is a bacterial ulcer. So which antibiotics would you use? As it is mentioned on the screen that these are gentamicin, tobramycin, chloramphenicol, ciprofloxacin, ofloxacin, getafloxacin, and moxifloxacin. So how would you remember all these drugs? Here is a mnemonic for it, and this mnemonic is gentleman and moxie. Gentleman, moxie, and co. Got tobra. You can modify tobra from cobra. So remember that gentleman means gentamicin, moxie means moxifloxacin, co for C there is ciprofloxacin, for O there is ofloxacin, and then got getafloxacin, and tobra for tobramycin. Okay, so this is the mnemonic. You can remember all the names of the drugs from this mnemonic. So all of these antibiotics are given topically, and you must give these antibiotics 4 times a day. Or we can say that depending upon the severity of the condition, you can also mold its dosage. And then comes antibiotic ointment. As in Pakistan, the most commonly used antibiotic ointment which is given most commonly in our clinical practice is Polyfax. So antibiotic ointments include Polyfax, tobramycin. Here this is tobramycin, Polyfax, or moxifloxacin. This is a single mnemonic from which you can remember even the topical antibiotics as well as antibiotic ointments, and these antibiotics ointments are given at bedtime. Then comes subconjunctival infection. Subconjunctival infection, in the case of this infection, you should give 0.5 ml of antibiotics like gentamicin. From this gentamicin, you can also remember your subconjunctival infection. So this is the single mnemonic which would cover all the modalities of your infection control, like topical antibiotics, antibiotic ointment, subconjunctival infection, and then comes systemic antibiotics. Systemic antibiotics particularly are not required in this condition, as you know that cornea is avascular condition. So when you will give the systemic antibiotics, as there are no vessels, and particularly systemic drugs first reach your blood, so very little amount, or you can say that no amount, will reach your cornea, so they are of no use in this case. However, they can be given if ulcer is near your limbus. Okay, as you can see that it is the limbus. This is the limbus, junction of cornea and sclera. So as you know that here are vessels present. So if corneal ulcer is present near this limbus, you can give systemic antibiotics as well. Or if there is ulcer perforation, you can also give them. Then comes uh, as you have controlled the infection first, then comes relief of pain. As this is a very severe painful condition, so you must treat the pain, because patient in pain cannot survive, as pain is also a very dreadful condition, and sometimes if there is very much severe pain, patient can die due to neurogenic shock. I'm not saying that in this case a bacterial corneal ulcer patient would die due to the neurogenic shock, but I am talking it as a general. Now, for the relief of pain, I talked in the previous video that you should remember these 3 modalities: that pain occurs due to ciliary spasm, stimulation of nerve endings, and raised intraocular pressure. I explained the reasons for that. So, to relieve the pain, you have to suppress all these conditions. You should relieve the ciliary muscle spasm, and you should give cycloplagics like atropine in this case. What would atropine do? Atropine is a mydriatic as well as a cycloplagic. Cycloplagic means it would cause loss of accommodation. You know, whenever you do close reading, then your eye would accommodate, and it causes the contraction of the ciliary muscles. and the ciliary muscle relax when you see fall. But in the case of prolonged close work, they can cause spasm, ciliary muscle spasm, and pain can occur. So, what cycloplegics would do, they would cause loss of accommodation, and as a result, they will relieve the ciliary muscle spasm. Other condition that atropine is also mydriatic. Suppose that whenever the pupil would be dilated, what would happen? Let us suppose that here this is the pupil, and if pupil is dilated, then what will happen? Posterior synapse formation would not occur. What is posterior synapse formation? Whenever the iris becomes attached to the lens, it is known as posterior synapse. If the pupil would dilate, then the chances of sticking off this iris to the anterior surface of the lens would be reduced. So posterior synapse formation would be reduced. And next is that as atropine is parasympatholytic, so it would cause vasoconstriction to some extent, and it would decrease the capillary permeability, and as a result exudate formation would also be decreased, and as a result intraocular pressure is decreased as pain occurs due to increased intraocular pressure. So by giving atropine, all these conditions can be treated. Now, analgesics are also given in oral or in injection form. Anti-glaucoma drugs are also given because pain occurs due to raised intraocular pressure, so we will give anti-glaucoma drugs. And anti-glaucoma drugs includes beta blockers, carbonic anhydrase inhibitors. You must know all about the anti-glaucoma drugs. Then there are miotics. Miotics, it means parasympathomimetics, should not be used. They are never used because they cause cyclospasm, and they also cause vascular dilatation. As these are parasympathomimetics, so intraocular pressure would also be raised, so they are never given in this condition. Then let's move towards the treatment of descemetocele. Let us talk about the descemetocele. Whenever the cornea, stroma of the cornea is destroyed, let us look at this picture. Whenever the stroma of the cornea is destroyed, what happens? This stroma, if the stroma is destroyed, then there is bulging out of the cornea, and whenever the cornea bulge out, then there are chances that other structures in the posterior portion of the eye would also bulge out. So we can define descemetocele as whenever the stroma of the cornea is destroyed, the descemet's membrane is exposed, and descemet's membrane bulge out through the defect. Okay, like this. Whenever the stroma is destroyed, this stroma is destroyed, this is destroyed, this is destroyed, then descemet's membrane may bulge out, and it will produce descemetocele, and it can also lead to the perforation of the corneal ulcer. So what should you do in this case? You must give pressure bandage in this case, like this. Pressure bandage is applied so that the bulged out descemet's membrane cannot be a problem for us. And then bandage contact lens like this, they can also be used. And straining factors, like whenever patient would cough or whenever the patient would sneeze or pass stool, then what would happen? Descemetocele risks increased. So avoid straining factors. And the other treatment is that a conjunctival flap can also be taken, and it can be applied on the cornea. As you know that conjunctiva is a vascular area, so it would also provide the nutrition to the cornea. Amniotic membrane transplant is also very useful because it has many growth factors, and it will play a role in the tissue repair or where there is corneal ulcer. So the remaining condition is that therapeutic corneal graft can also be used, and this corneal graft can be either partial thickness graft or complete thickness graft, depending upon the severity of the ulcer, that either all the layers of the cornea are involved or only some layers are involved. Then comes treatment of the perforated corneal ulcer. It is treated in the similar way. You should give first of all topical antibiotics in order to relieve the condition or infection. Then you should anti-collagenase mechanism, because whenever there is healing, there is increased collagen formation, so you should give anti-collagenase medication. Pressure bandages, as I have shown you previously, and other bandage contact lens, as I have shown you, they can also be used. And tissue adhesive glue like cyanoacrylate glue can also be used. As I explained previously, that conjunctival flaps can be used, amniotic membrane transplant can be used, and corneal graft from any other person can be used, and it can be full thickness graft or partial thickness graft depending upon the severity of the ulcer. Then there is treatment of non-healing ulcer. What you would do with the non-healing ulcer? You would apply any conjunctival flap, or you can also do tarsorrhaphy. I will tell you what is tarsorrhaphy in the end. You can also use some lysyl cord serum. Amniotic membrane transplantation, therapeutic keratoplasty. Keratoplasty is that full thickness graft of cornea, or partial thickness graft can also be used. So you must remember all of this. Now, what is tarsorrhaphy? As you know that bacterial corneal ulcer has occurred, and we have to protect it from the external environment. So what is done that by doing a small or minor surgery, the upper and lower lids of the patient are put very much close together in this way, so that the cornea of the patient is not exposed so much to the outer environment. Okay, like this, upper and lower eyelids are put very close together, so that cornea is not exposed very much to the outer environment. So that was all about the treatment of the corneal ulcer. Hope you enjoyed this video. Allah Hafiz.